Hi, happy February. This is Dr. Merrill from Coates Hearing Clinic, and I'm here today to talk to you about how February is American Heart Month and how it is related to issues with hearing loss. What is heart disease? Heart disease refers to many conditions that result in poor blood flow to the heart. Some of these disorders cause poor circulation or coronary artery disease, congestive heart failure, and pulmonary hypertension. When there is poor circulation, the heart does not have enough blood to pump and can result in heart failure and heart attack. So some other risk factors that attribute to heart disease are high blood pressure, smoking, high cholesterol, diabetes, obesity, excessive alcohol use, and physical inactivity. What are the facts? Heart disease is the leading cause of death in the United States. Coronary artery disease, CAD, is the #1 cause of health disease in America, and it can also lead to heart attack. 18.2 million Americans have coronary artery disease, so if you have it, you're not alone. Heart attacks occur in about 805,000 American people every year. 655,000 Americans die from heart disease a year, and the disease affects women and men equally. Over $200 billion a year is used for heart disease-related issues. And 49% of Americans have one of these major issues that attribute to heart disease: high blood pressure, high cholesterol, something like that. So why are we talking about it here at Coates Hearing Clinic? Hearing loss and heart health. It is recommended to get a hearing test, a baseline hearing test, for anybody who has any cardiovascular conditions, because it can be very related to the heart. I'll talk about that in the next slide. But if you have sudden hearing loss as well, contact your physician immediately. It could be related to any heart issues. So the inner ear is very vascular. If you look at this picture to the right, there are a lot of arteries, there's a lot of veins, there's a lot of blood flow into the inner ear. So it brings good and healthy blood flow to the hair cells of the ear, which are those cells that stimulate the sound and bring it to the brain. And it allows the cells to be able to activate the nerve and to determine sound or movement in the body. If a patient has heart disease, or cardiovascular issues, the circulation of the body is affected, right? So if you have a heart disease, the pumping of the blood flow is a little bit messed up, so therefore the vascular system to the ear is going to be damaged as well. Poor circulation causes oxygen loss to the cells, and so if you have poor blood cell, and then you have deprivation of oxygen, this can cause damage to the cells in your ear, resulting in hearing loss or vestibular damage or balance issues. Many research studies have shown that cardiovascular disorders are risk factors for sensory neural hearing loss or permanent nerve hearing loss. So it is recommended to get exercise, which might help hearing, and all of those critical things that help with heart health would also help with preventing pretty significant hearing loss and preserve those healthy cells for a longer period of time. So if you think you have any issues with your heart, February is Heart Health Awareness Month, so we want to make sure that you have a baseline hearing test, just to kind of be able to track your hearing as well. So if you want to call and schedule an appointment today, we are available for you. We also will coordinate with your cardiologist and your primary care, so that they will all have the information and we can work together for a good team effort. Thanks. Have a great day. Happy February.